Good morning, everybody. Day 133, 19 weeks completed tomorrow. Started into the 20th on Friday. And like I said yesterday, didn't think we'd still be doing this, but we're all in this together. But before I get started, kind of want to go outside a little bit differently. Yesterday at 1400, we got a press release from the governor's office saying that we had someone that passed away in Albany County. It's almost 24 hours later, and we still can't verify it. And sorry, it's an exhausting laugh that I have because we're 19 weeks into this. This shouldn't be happening. So, if we do have someone that passed away, to the family, my condolences and prayers go out to you. It would move us up to 123, but we cannot verify this at the time. So, one of the things back on May 25th, when we discovered 11 deaths that happened in late April at Our Lady of Mercy, that was reported to the state, but not to us. Then 2 days later, we discovered another 24 previous unreported deaths at 3 other private nursing homes in Albany County between April 21st and 25th. It was frustrating then, but we thought we worked it out with DOH and everyone else, and obviously it didn't happen. So we are chasing that down. We're still trying to find out. My health department, Epi people are doing a great job, and everyone else doing with the tracing. The Tippy Moose, I read it on Facebook last night. Someone had sent it to me, and I went to Facebook. We didn't know. So we are investigating that this morning. We did verify the worker is an Albany County resident. As I was walking in, Mary met me, and we just got the green light that it is a worker, and now they will be investigating the Tippy Moose and doing the tracing and mapping. And it gets important because without that, and without people being honest where they work or who they've been in contact with, this is how the virus continues to spread. So that will get me into the beginning of this to talk about there's now 2,139 positive cases of COVID-19 in Albany County. 664 people under mandatory quarantine. We have an increase of 14 positive cases since yesterday. So, it was nice to have the 1-in-1, thinking we're going back the other way. But out of these new cases, we now have 4 are linked to Hudson Avenue again, the party group. So 4 more of that 14 are linked to the 200 people. 2 cases of healthcare workers, 4 are families who traveled. So we have 4 more people that decided to go on vacation, go visit friends, family, or that they would stay isolated and safe while they came back positive. We have 1 is a close contact to a positive case. So, and then the 3, again, kind of like the 6 yesterday, we don't have a clear path of what exposure they had, and what we mean by that is that if the person lies to us, we can't say they're lying. If they say, I wasn't here, I didn't meet this person. So one of the things, it turns out at the 6 yesterday I talked about, 2 of them now, from yesterday to the 6 that we couldn't trace, we traced it back to the 200 people that were partying on Hudson Avenue. So it brings the total up to 28 people so far now that have come positive out of that party. And then a couple days, not just the one day on the 4th of July, that weekend they were partying together. I will say this, when people send us questions or we read your comments on Facebook, look at, I can't compare the protesters versus them. Protesters had masks on. They weren't sharing food. They weren't sharing or drinking. They weren't close. They were close together, but they had masks and they were social, to a distance. Can't explain it. But when you have a party and you're not socially distancing and you're hugging and you're dancing and you're having a great time, there's a big difference. So protesters did it right. Partiers aren't doing it right. That's why I look forward to having President Rodriguez or Javidant on tomorrow and President Gibson to talk about what they're doing at the U Albany and talking about what Siena College is doing and how they're addressing this going forward, which they have, both U Albany and Siena have really great plans in place, how they're going to handle different scenarios, and they're on top of it. But who better to hear from them than for me to say it? And I thought it was important to have them here tomorrow, especially after Hudson Avenue. And I got to tell you, U Albany's been a great partner. They're on top of this. They're working with us. They're not happy, so they're doing their due diligence to make sure this doesn't happen again. But I think a comment I got on Facebook, rightfully so, from a guy said, well, how do you control 20-year-olds to 29? Yes, I have a 25 and 23. Absolutely cannot. You can sit there and talk to your blue in the face. You can tell them all the ins and outs, but they're going to do what they want to do, and hopefully they do the right thing. So that's where we're at. So I encourage people out there to get tested, to go to the mobile testing sites we have established, go to UAlbany's drive-through, go to Sethku Arena. Yeah, I know. Well, why would you go get tested if you don't have signs or symptoms? I get it. But that's that age group, and I'll say this as a parent, I'll say this as your county executive, I'll just say this as a fellow resident of Albany County. Just go do it, and so then to keep socially distancing, then to stay home for 14 days, or you just know what you're doing when you're out working. It takes 5 minutes to get the test done. And again, if you don't have insurance, we pay for it. And the state's not looking at either, they're just paying for it. So that's a good partnership with the state of New York and Governor Cuomo that's making sure that happened. So again, I say to the people that were at that party July 3rd through the 5th, please get tested. Please call our Department of Health also. We would like you to call 447-4640. We're not there to lock you up. We're just there to do our job so we can see how much more exposure we're getting from this one party weekend. And what it's costing us moving forward. Because the last thing I want to do is tell everyone, or the governor, I think, said it yesterday, shutting people down. Businesses, listen, I've gone out to businesses, I've talked to the business owners that are struggling after the riots, that are trying to, can't get insurance claims, trying to get their businesses back up and running. Restaurants trying to figure out the new model, what works, doesn't work. I get it. I get it. And, we want to be a good partner, and I don't want to sit there threatening people with fines or putting the SLA on them. It doesn't help. It really doesn't help that business owners, because when I talk to them, they're under a lot of stress. They've been in like everyone else. They had to revamp their businesses. You can see it in their face. So the last thing they want to hear from a politician is that we're going to fine you, close you up, and shut you down. They're just trying to pay their bills right now, and they're just trying to figure out what works and doesn't work, and if they're going to be able to stay open like we are. So I say to the customers, please, again, do the right thing. You have to police yourself. So I'm going to be reaching out to the district attorney, David Soros, and Sheriff Apple to talk about it. We've gotten, I think, over 1,000 complaints, and they chased them down. And a lot of them are people complaining. People have their mask under their nose, under their chin. The workers aren't doing it. It is hard. The beer garden, yes, couldn't remember that yesterday. My hat's off to that owner to say, hey, look, I'm staying closed until we can figure it out. It is tough. And it's not right to sit there and hold it against the restaurants or where you're out, the food establishments or whatever you're going out to do. It's hard. They're trying to do the right thing. Help them. That's what it's about. We need to help each other. That's the only way we're going to get through this. I get it. Workers, I was in a store yesterday, had it under, even though they're behind the plastic, they got the plastic, they still have to wear their mask, and they have it under their nose. And then even look, people forget. I was with somebody and I go, hey, over the nose, and it just becomes habit forming, right? So we need to break that habit, make good habits going forward. And the only way we're going to do that again is by, again, being in this all together. I get it. I want people to tell us when somebody's not doing wrong, but a lot of it turns down to they had fruit flies or they had this, and I get it, but again, you don't have to go into that establishment. We want them to do what's right for the workers. We want the workers' safety comes first, and the patrons and the people that are out and about. So please do the right thing moving forward. So out of all the cases, there's 84 active cases in Albany County as it stands. 6,614 people have completed quarantine. Of those, 2,055 tested positive for the virus, have recovered. We have 7 new recoveries since yesterday. There are now still only 3 people in the hospital, with 1 person still in the ICU out of the 3, for a hospitalization rate of 0.14%, that those have tested positive. Yesterday, the rate stays the same, and it stayed the same yesterday. Over the last 5 days, there's been an average of 12 new positive cases each day, so the rate was 11.58. And again, please go to U Albany, and what I said, the South Q Arena, the number is 1-888-364-3065. Yes, Bob, the comment, I should remember these numbers. I've been saying them for 19 weeks and I still forget them. So the testing sites for mobile testing, please, by all means, area code 518-465-4771. And then the Rite Aid in Colony, as always, go online and register online. And then Priority 1 in Gilliland for the antibody testing, area code 518-867-8040. And again, just remember, please, man, social distance, wear a mask, cough into your arm, and clean your hands. I mean, I think we were taught that as kids, not wearing a mask, but and not so much as social distancing, but people have their space, and let's just keep within that 6 feet away from each other if you're not with the same group. Some of the things people talk about us on the rail trail, a lot of these are families that have been together. Some have big families, have little, they've been together the whole time, so that's okay. They're in that same circle, so that's going to work, and you don't need to, I'll say to people, I go, look, don't confront people, please don't. It's not worth you getting your blood pressure up. It's not worth having that confrontation. People are on edge because, again, the world is different. And I know some people handle it differently. I've said this a couple times now. My stress level is different than your stress level. And certain people, they come out after being home for 14 weeks that we're doing the right thing, and they see this going on, they're aggravated. And there's people that don't want to wear masks to this day and think it's their constitutional right. And this country is based on freedoms, and we can agree to disagree, but we have to work together at the end of the day. So agree to disagree, but continue to work together for the good of the people here in the county. So keeping that in mind about using your mask, you need to cover your nose and mouth at all times, not under your chin. I get it. There's people commenting. I do switch out my mask all the time. I have multiple masks that I go with, and I get it. You are contaminating it when you pick it up. I'm not perfect. No one is. This is all new to us, so we're trying to do our best. But I do appreciate the comments from people. So if we continue to do the right thing, and the one thing I can't explain, we're getting more cases. It's going the other way. You look at the governor added, I think now there's 31 states that you can't travel to. I knew a guy going down to Maryland yesterday, and I felt bad for him. He had to turn around because by the time he was getting there, it just hit the list. So he had to literally turn around and drive back to New York State because now Maryland's on there. That's going to happen. And, again, we have to do this together, working together, and that's the only way it's going to stop. But we keep getting this million-dollar question, and I can't answer it. And I've checked the health experts and went to doctors and all the sites. And why is our hospitalization rate staying low? ICU beds aren't being utilized. Why the spread? Is it different? I don't know. It morphed. It seems not, thank goodness, thank God, it doesn't have the same effect it did back 19 weeks ago. We're not seeing that. Doesn't mean it's not going to go that way. I don't know. So do you treat it like a flu? Everyone gets it. Chicken pox. When you got chicken pox, my mother put us all in the same room. We all got it. I had people say that to me. They're like, well, I got it, so I'm going to let my kids. No, it affects everyone differently. It's not the chicken pox, lady. Don't put your kids in the room and expose them to it. These are things we can't answer, and again, listen, I'm at the mercy of this virus. We're at the mercy of the guidance from the federal government and from the state, and how we handle this going forward. So until we get better guidance, I don't know. Is it something we should be alarmed about as the numbers continue to go up in the wrong direction, as long as the hospitalization rates? But people with underlying health issues, asthma, different things like that, COPD, have stuff to truly worry about, and you don't want this. So these are the things that hopefully them seniors are doing the right thing, staying away from everybody, and that's why we're not seeing that. But that being said, I do want to say, as always, our mental health line is there. We have some great professionals answering these phone calls for people. Again, please no one's keeping track of you. That's a question we get, that you're going to be arrested, someone's going to send someone to your house. No, they're just there to listen to you. Again, if you're embarrassed to talk to someone in your family or your spouse or your husband or your lover or your neighbor or your friend, call this number. Again, they're not going to say no to you. They're not going to laugh at you. They're going to sit there and say, okay, this is what you need to do. I've said this over and over and over again since day one. This is going to be a marathon. It's not going to be a sprint. It's the long game here, people. And we're all figuring it out. And to be part of the solution, not part of the problem. Again, I'll say this. It's easy to be a Monday morning quarterback and point fingers at theories and, yeah, well, you have 300. There's probably like 320,000 residents based on the new census. But, yeah, going off the old 305, you can break the math down. You can sell it to me any which way you want. I get it. Whatever makes it easier for you to go forward. And you can have your agreements or you can have your disagreements, but keep it peaceful. No need to bash people on Facebook or in person on how you feel this is going forward. We're not here in Albany County, in the Capital District. We're not trying to fearmonger. We're not trying to scare people. It's my job just to put the information out there as we see it, as it comes to us, and just let people know where we're at and where we're going. I've said this again now. We're dealing with a health crisis, an economy crisis all at the same time. And look at the recession, go online, look at 1918, look at 2008, 2009, 2010. The little recession we had there was a little one, and the big hiccup in jobs that we lost. We're there again, and this is going to be worse. And as the next couple of months roll on and the next quarter comes in, not just governments, private companies, restaurants and bars, hotels, you'll see more close down. You'll see new businesses start. But things are going to be different, and we need to figure this out together. I don't have all the solutions, so please continue to send your comments into my office, continue to reach out to my office, because again, I'm not going to sit here and tell you I have the answers. No, I'm not the wizard, and I'm not sitting behind a curtain, and I'm going to tell you everything you need to know. But with your help, we can do this together. With your help, we can do this as one, and we can get through this. So please, again, if you have any mental health issue questions, 8 a.m. to 5 p.m., 7 days a week, 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. The 201 for United Way, great partnership, still continue with the United Way and New York State hotline, 188-364-3065. Again, we're strong as we get knocked around in the state of New York, and we continue to grow from everything. So please, people, continue to do the right thing, and we'll get through this.